Saudi German Hospital Cairo is considered one of Egypt's most reputable hospitals. It belongs to Saudi German Health. In 2016, Saudi German Cairo was established in Egypt, and it is the 7th tertiary care hospital branch of Saudi German Health with a capacity of 300 beds. But only hard times can reveal true colors. In December 2019, we heard about COVID-19 for the first time from Wuhan, China.
Over the past few weeks, we have witnessed...
By the end of January 2020, WHO declared a public health emergency announcement. On February 14th, the Egyptian Ministry of Health announced the first case of COVID-19 in Egypt. Instantly, the Saudi German Hospital top management established a crisis management center that is consisted of the senior management committee, along with a scientific committee having all department leaders who are responsible for diagnosing and managing COVID-19, as well as executive committee heads responsible for actions and plan execution. To be fully prepared to face the pandemic threats, intensive medical training was given to all medical staff, physicians, pharmacists, dentists, physiotherapists, and nurses. In no time, the plan was mapped into 4 stages. First, determining the actual capacity of the hospital. Then, the suspected cases were received either through clinics or ERs, sorted out and transferred to the Ministry of Health, all while carefully following the instructions provided to private hospitals on quarantine and dealing with suspected cases of COVID-19. And lastly, preparing the entire hospital for receiving, hosting, and treating COVID-19 cases.
We have therefore made...
Then, on March 11th, the WHO declared COVID-19 a global pandemic.
A pandemic.
But there was no time for fears or worries. Instantly, decisions and precautionary measures had to be made to prevent the virus from spreading within the hospital and controlling the situation. The Saudi German hospitals immediately granted paid leave to immunocompromised workers and those most at risk, with a sick leave for anyone who shows any respiratory symptoms, and equipping all staff with protective supplies of sanitizers, hand washing kits, and medications. According to the Ministry of Health protocols, we provided enough supply to last 6 months that covers the hospital needs during the pandemic. But that's not all. Saudi German Hospital Cairo secured enough medical uniforms, scrubs, and shoes for all medical staff, as it was prohibited to leave the hospital with any medical clothes or enter with personal ones. And due to the lack of face masks in the market, we decided to produce them ourselves. The dining halls were also expanded, and the tables were kept apart to allow social distancing, as well as increasing break times for breakfast, lunch, and dinner, to avoid crowdedness and reduce the risk of the virus spreading. Along with providing sufficient kitchen stock and ready-to-cook meals to be used in extreme emergencies. The hospital vehicles were also disinfected. Hand washing stations were set up in front of the main gates, ER, and employees' gates as well. We've also recorded an automated voice message for the patients who call us, informing them all the rules and instructions they need when they get to visit the hospital. And within only 40 days, we were able to establish a new isolated intensive care unit. April 1st, 2020. The Egyptian Ministry of Health gave the green light to private hospitals to manage COVID-19 cases as per the MOH protocols. All that time, we've been in contact with the hospitals in China with the coordination of International Finance Corporation and Mayo Clinic Care Network in order to benefit from the coronavirus managing experience. During the crisis, the nursing team conducted a visual and oral screening to identify cases suffering fever or respiratory symptoms. A red zone has also been set up to deal with suspected acute respiratory symptoms. But the suspected cases will be isolated from other outpatient clinics, including 3 fully equipped clinics to deal with them. And if any case is suspected, it will be immediately transferred through designated corridor to the isolation area of the ER department. And a waiting area has been set for patients' relatives in a safe area and with the appropriate social distancing measures. For sure, COVID-19 crisis had many losses, but we have learned a lot along the way, and we saw the essence of our heroes from the medical teams who took the challenge facing danger themselves. Without those heroes, we wouldn't have passed such a crisis the way we did. That crisis has made us aware of two crucial points. First, the importance of our continuous trainings, which gave us the ability to manage any crisis with a full, ready to engage, wise teams, always 2 steps ahead. Secondly, we all owe the medical members all over the world our gratitude. Without them, we wouldn't have been able to survive such a crisis the way we all did.